Morning, students. Good morning, students. This is a review class of mental metabolism disorders. Mainly, these metabolism disorders are calcium, phosphorus, copper, selenium, iodine. Calcium. Calcium is one of the most abundant mineral in the body. Calcium mainly required for the development of bone and teeth formation and blood coagulation, nerve transmission. Calcium is mainly required for 99% is mainly required for the bone and teeth formation, and 1% is mainly present in the skeletal tissue. Calcium mainly it functions required for the development of bone and teeth formation, blood coagulation, nerve transmission, muscle contraction. Here, the calcium is also act as a mainly secondary messenger. Activation of enzyme like in ATPase, lipase, and also release of some hormones like parathormone, calcitonin, insulin, and vitamin D. Here, the calcium can mainly act as a secretory process of endocytosis and exocytosis in cell motility. So the normal range of calcium is 9 to 11 milligram per deciliter. Deficiency and disorders of calcium. These are main signs of calcium deficiency. The calcium levels ranges in between 9 to 11 milligram per deciliter. When hypercalcemia means the elevation of serum calcium levels. Hypocalcemia means the serum levels of calcium below 7 milligram per deciliter is known as an hypocalcemia, which causes mainly teething and also neuromuscular irritability, spasms, convulsions are mainly due to the hypocalcemia. Rickets. It is mainly due to the defective in calcification of bones and also due to the decreased levels of vitamin D, due to the dietary deficiency of calcium and phosphorus, and osteoporosis, decalcification or demineralization of bone, and also osteopetrosis. Here, marble bone disease means increases the bone density here. Hypocalcemia. First, we are learning about the causes and features and treatment. Causes: inadequate intake or impaired absorption of calcium, increased excretion of calcium, or mainly due to the magnesium deficiency. Mainly example of acute pancreatitis. Hypocalcemia, mainly muscle cramps or tetany. Here, hypocalcemia means the calcium levels are below 7 milligram per deciliter, mainly leads to the tetany and carpopedal spasms, Chostok sign, Trousers sign. These are mainly neuromuscular irritability features. First, laryngospasm and convulsions or muscle cramps of tetany and cardiac arrhythmias and prolongation of QT interval, cataract, chronic hypocalcemia. Chostok sign. It is a contraction of facial muscle in response to the tapping of facial nerve by marking of facial nerve. Trouser sign is mainly known as a carpopedal spasm. It mainly occurring at occlusion of brachial artery with BP cuff for 3 minutes. Shostok sign is a twitch of the facial muscles where gentle tapping over the course of facial nerve in front of the ear that indicates that hyperirritability of facial nerve. Hypocalcemia treatment. Severe symptomatic cases are slow intravenous calcium gluconate and asymptomatic cases are calcium carbonate and vitamin D. Hypercalcemia, elevation of serum calcium levels. Here hypercalcemia is associated with hyperparathyroidism. Here in hyperparathyroidism, increase the activity of parathyroid glands. Whenever the increases the activity and decreases the serum phosphate levels, whenever the decreases the serum phosphate levels and increases the alkaline phosphatase activity. So the causes are mainly increased intake, increased absorption, decreased excretion and malignancy. Features are mainly metastatic calcification, neurological symptoms and renal symptoms, gastrointestinal symptoms and cardiac arrhythmias. These are main symptoms and features of hypercalcemia. Rickets. Rickets is mainly due to the decalcification of bones here. Here, mainly due to the low levels of vitamin D deficiency or due to the dietary deficiency of calcium and phosphorus. Rickets. Renal rickets. Renal rickets is mainly associated with damage. Here, renal rickets is mainly associated and damaged with renal tissue and impairment in progressive loss of bone mass. Here, the patients with chronic renal failure or renal rickets are mainly due to the decreased synthesis of calcitriol in the kidney. So, it can be treated by administration of calcitriol. Osteoporosis is mainly demineralization of bone due to the progressive loss of bone mass here. Here mainly it can be seen in elderly people over 60 years. So mainly seen in postmenopausal women. Osteoporosis means frequent of bone fractures here. And the stages of osteoporosis, this is normal bone osteoporosis and severe osteoporosis. Here severe osteoporosis or osteoporosis means reduce the mass and makes the bone weak here. Next, osteopetrosis is a marble bone disorder. So it is one of the genetic disorder in the bones, which bones become often harder and denser. It tends to be lead to the bone get be dissolved and ultimately break here. This is an osteopetrosis, normal bone here, comparison with osteopetrosis. Nothing but osteopetrosis means increase the bone density. Next mineral is phosphorus. And total phosphate is 500 to 800 mg. It is mainly required for the bone and teeth formation as similar to the calcium. 80 to 85% is required for the bone and teeth formation. Normal plasma level is 2.5 to 4.5 milligram per deciliter. Phosphorus is mainly divided, normal plasma phosphate is mainly divided in two types, organic and inorganic. Organic, 0.5 to 1 milligram per deciliter. Inorganic, 3 to 4 milligram per deciliter. In children, 5 to 6 milligram per deciliter. Here, if we see the biochemical functions of phosphate, phosphate is also mainly required for development of bone and teeth formation. It also plays a central role in utilization of high energy phosphate like in ATP, CTP and creatine phosphate. And here phosphate is also plays a vital role in the lipid absorption and phosphoproteins. Here the levels, if you see the total phosphate level mg is 500 to 800 mg. Normal plasma level is 2.5 to 4.5 milligram per deciliter. If the condition is excess, we are saying that hyperphosphatemia. When the levels are below, we are saying that hypophosphatemia. Hypophosphatemia, mainly decreased absorption of phosphate, is mainly seen in malnutrition and malabsorption, and mainly due to the vitamin D deficiency. And increased urinary excretion of phosphate is mainly seen in hyperparathyroidism and intracellular shift of respiratory alkalosis. The conditions are mainly lethargy, confusion, lightheadedness, nausea, vomiting, seizures, hyperventilation, bradycardia, and also hypokalemia. These are mainly disorders of respiratory alkalosis. Next, example of chronic alcohols. Hyperphosphatemia means dull. Here, elevation of phosphorus. So the serum phosphate levels are elevated. So mainly we can see in increased absorption of phosphate, excess vitamin D, or phosphate infusion. Decreased excretion of phosphate is mainly seen in hypoparathyroidism. Whenever here parathyroid hormone is increased, the secretion of parathyroid hormone secretion is increased. Increased excretion of phosphate into the renal tubules. Whenever the low levels of increased excretion of phosphate in renal tubules and decreases in parathyroid hormone secretion. Whenever it is decreased the phosphate in renal tubules, here the balance again. Increased cell lysis. Mainly we can see in chemotherapy for cancer. There are direct action and indirect action. Direct action means radiation, prone to the DNA damage and cell death. Indirect action means here release of free radicals here. Here release of free radicals which damages the DNA and causes the DNA cell death. And type of bone cancer. These are the main differences between hyperphosphatemia and hypophosphatemia. Here, increased absorption of phosphate here and decreased absorption of phosphate here. In absorption of phosphate in malnutrition, malabsorption, chronic diarrhea, and vitamin D deficiency. And increased cell lysis is mainly seen in chemotherapy for cancer and bone secondaries. Decreased excretion of phosphorus is mainly seen in renal impairment and hypoparathyroidism. Increased urinary excretion of phosphate is seen in hyperparathyroidism, hypophosphatemic rickets. Next mineral is selenium. Here, the selenium is originally identified as a mineral in animals, but it causes of toxicity. Hence, it is also known as an alkali disease. In many USA, the selenium is mainly present in the soils. So, selenium plays a vital role in its biological importance in a very small amount. Functions. First, in thyroid activity, in presence of enzyme deiodinases. There are three types of deiodinases are there. Type 1 deiodinases, type 2 deiodinases, and type 3 deiodinases. Here, in presence of deiodinating of T4 to T3 means conversion of T4 to T3 here, and also which is responsible for T4 conversion of T3 in the brain and responsible for deactivating of T4, T3 and T4. Next, cardiometabolic health. Here, whenever the oxidative stress which releases the free radicals which mainly act on heart diseases. Here the selenium is one of the antioxidant. Already know that it is also which limit the oxidative stress here, and LDL cholesterol also which therefore prevent the coronary artery diseases mainly. So the release of free radicals, oxidative stress, we already know that release of free radicals for mainly acting on heart diseases. These heart diseases here the selenium plays as an antioxidant role here. antioxidant role in against of oxidative stress here. This is a normal cardiac and also dilated cardiomyopathy here and hypertrophic cardiomyopathy and restrictive cardiomyopathy. Whenever the selenium deficiency, there is a low levels of selenium here and decrease of glutathione peroxidase enzyme and increases the oxidative stress. Whenever the increases the oxidative stress, which prone to the myocardial injury and ventricular dysfunction and prone to the cardiomyopathy. So it is a normal condition. It is a dilated cardiomyopathy. Here hypertrophic means increase in its size. Restrictive cardiomyopathy. When there is a selenium deficiency, it is mainly due to the decreased levels of selenium here and decrease the glutathione peroxidase enzyme, increases the oxidative stress, which mainly prone to the myocardial injury and ventricular dysfunction here and prone to the mainly cardiomyopathy. Selenium plays a vital role in the cancer. The release of free radicals. This release of free radicals mainly damages the gene here and causes a cell mutation. The cancer cell develops here. The cancer cells which spread to the other organs mainly and prone to the organic failure and finally lead to the death. Kishan disease is mainly due to the endemic cardiomyopathy when there is a low levels of a selenium deficiency leading to the muscular dystrophy, loss of appetite and nausea. Copper. Another mineral is copper. Here, copper is mainly distributed in other organs like in liver, kidney, heart, brain, and also here copper is mainly 100 mg. It is mainly distributed in various organs. These are the main sources of copper here. We already know that it is intelligent people have a more zinc and copper in their hair. The functions of copper mainly required for the development of bone and nervous system. For bone development, copper plays a vital role. In nervous system development also, copper plays a vital role here. Here, the copper is one of the constituent of several enzymes. Due to the variety of enzymes examples, they are involved in metabolic reactions. Copper, example, delta amino levulinic acid or ALA synthase enzyme, ascorbic acid oxidase, monoamino oxidase, superoxide dismutase, tyrosinase, catalase, cytochrome oxidase. Here, tyrosinase, which plays a vital role in melanin formation. And another importance, and also copper. Copper is mainly essential for the synthesis of hemoglobin. Here the copper is also constituent of several enzymes like an example ALA synthase, delta amino levulinic acid in presence of amino levulinic synthase here. So here the copper is mainly essential for the synthesis of hemoglobin. And the copper is also necessary for synthesis of melanin and phospholipid. Melanin in presence of tyrosinase enzyme. Hemocyanin. Hemocyanin is a copper protein complex in vertebrates but functions like an hemoglobin for oxygen transport. Copper containing non-enzymatic proteins. If it is copper is present in the liver, so hence it is called as an hepatocuprine. Whether it is present in blood, hemocuprine, whether present in brain is also known as an cerebrocuprine. The plasma copper levels are ranges of 100 to 200 milligram per deciliter. They are mainly 95% is tightly bound to the celloplasmin and 5% is loosely bound to the albumin here. So the normal concentration of serum celloplasmin is 25 to 50 milligram per deciliter. When there is a deficiency, of low levels of celloplasmin, which mainly lead to the microcytic hypochromic anemia, is mainly due to the demyelination of neural tissue and demyelination of neural tissue, which mainly lead to the fragility of arteries mainly. So this is microcytic hypochromic smear here. When there is abnormal and low levels of copper, which mainly lead to the Menkes disease here. Here, when there is a defect in intestinal absorption of copper, means the dietary copper here. So here the copper which is present in the intestine, which is mainly trapped as metallothionein. So here the copper which decreases the plasma copper, decreases the plasma levels of copper and increases the urinary excretion here. So when there is a high levels of copper in small intestine and kidney, and there is a low levels of copper in brain and also and the skin and hair and bones, the presence of low copper here because due to the defect in the metabolism, intestinal absorption of copper here because the presence of metallothionein which is deposit here in the intestinal cells here. So the symptoms of Menkes disease include decreased copper in plasma, which mainly lead to the anemia and depigmentation of hair. And one is Menkes disease, second one is Wilson's disease or hepatolenticular degeneration. It is also mainly X-linked autosomal recessive disorder of copper metabolism. See, this is a female carrier, affected male here due to the mainly defect in the gene here. So it is an autosomal recessive disorder of copper metabolism. Here mainly ATP7B on chromosome is 13 dependent metal transporter for Golgi hepatocytes. Here failure to the excretion of copper into the bile here. So the copper causes of liver injury mainly affects the brain, coma, kidney, bones and joints of parathyroid glands. When there is a decreases of serum celloplasmin, mainly prone to the increase the urinary excretion. Hepatic increases the hepatic coma and hepatic necrosis. Menkes-Hayes syndrome means Steely-Hayes disease here. Wilson's disease is also known as an hepatolenticular degeneration. These are the other complications which are associated with this Wilson's disease here. When it is hepatolenticular degeneration, means hepatomegaly or jaundice and acute pancreatitis and also portal hypertension, bleeding varies and also prone to the cirrhosis and renal, proximal or renal tubular dysfunction and also in cardiac and eye complications, Kaiser fissure rings, mainly due to the deposition of copper in the membrane and also hemolysis and arthritis. See, the copper is mainly deposited abnormal amounts in the liver and lenticular nucleus of the brain. This mainly lead to the hepatic cirrhosis and brain necrosis here. Signs and symptoms. Patient present with hepatitis, mainly cirrhosis. This can be Wilson's disease mainly manifested due to the severe hepatic failure. So hepatic decompensation is mainly associated with ascites, peripheral edema, hepatic encephalopathy, and neurological presentation of dystonia tremors, incoordination. Kaiser-Fleischer rings means it is also known as an KF ring. It is also termed as an KF ring. Ocular signs is mainly caused by the copper deposition in the Descemet's membrane of cornea. Sunflower cataracts is due to the copper deposition in the lens here. Treatment of Wilson's disease. Mainly the chelating agent is penicillamine. 250 mg of capsules here. It is mainly bind and accumulated at copper and eliminated through the next chemical, iodine. So the RDA of iodine is mainly 150 microgram per day. The functions of iodine is mainly synthesis for thyroid hormones of T4 and T3. When there is a deficiency of iodine, mainly this is a normal thyroid gland, trachea with wind pump, larynx. Enlargement of the thyroid gland mainly lead to the endemic goiter. When there is an abnormal increase of thyroid gland, which mainly lead to the endemic goiter. Next, in children's cretinism, mainly mental retardation. A man and 3 females age range of 70 to 80 years with mixed sedimentals and cretinism. Mainly due to the iodine deficiency. And treatment for iodine deficiency is mainly potassium iodide. For Wilson's disease, penicillamine. Here, potassium iodide. Hypocalcemia treatment is slow intravenous calcium gluconate in symptomatic cases. In asymptomatic cases are mainly calcium carbonate and vitamin D. This hypocalcemia treatment. Thank you. What will